Dr. Sarah Solich, the Chief Medical Officer of Access, Arizona's Medicaid agency. Dr. Solich has worked with both youth and adolescents in a clinical setting, and now she serves in a public policy role. Dr. Solich is here today to help us understand how we got to this point, as well as what the public should know about prescription opioids. Dr. Solich?
Unfortunately, it was the convergence of multiple factors, including the pharmaceutical industry promoting their product and minimizing the risk associated with the use of their products. Practitioner prescribing of opioids to all chronic pain conditions. Additionally, the public's request for a pain remedy that was effective, and the healthcare industry's monitoring of pain as the fifth vital sign. There's also an inflooding of the illicit market with illicit opioids.
So what's the risk of prescription opioids?
Physical dependence on the substance, so needing more of the substance in order to have the desired effect. It could also have withdrawal symptoms, so if you don't have the drug, you can experience flu-like symptoms.
So how can, for instance, my body tell the difference between prescribed opioids or illicit opioids?
Your body can't tell the difference between a prescribed versus an illicit opioid. It all boils down to the dosage. Just to put things into perspective, fentanyl is 50 to 100 times more potent than morphine is. And so your brain is responding to the dose of the opioid. It doesn't matter whether or not it was gotten from the streets or gotten from your provider. What we're seeing is this epidemic of fentanyl overdoses based on the potency, and nearly 4 Arizonans a day are dying based on overdose.
The pharmaceutical companies, they pushed opioids with false informations, and now we're looking for a pharmaceutical solution with MAT. Why should we, the public, trust the pharmaceutical companies now?
From my perspective, the way that we can rebuild that trust is by acknowledging that opioids do have those major risks. There needs to be those checks and balances where those researchers that are researching the product, that there's a separation between that and those that are actually publishing and reviewing the results, where there's not a conflict of interest, including peer-reviewed journal articles as well as meta-analysis through Cochrane to tell us what is the science, what is the data telling us. And so with that, what the data is telling us is medication-assisted treatment. That's an FDA medication to treat opioid use disorder in combination with psychosocial interventions such as therapy, peer support, that is the most effective intervention to assist an individual in recovery, both retaining that individual in treatment as well as a decrease in illicit substance use.
Well, thank you, Dr. Solich, for being so candid. We appreciate it.
Thank you for addressing this critical public health crisis.